This medication is used as a part of a weight loss program that includes exercise, behavior change, and a reduced-calorie diet. It is specifically for overweight individuals, such as those who are obese or have weight-related medical issues. Losing weight can help reduce health risks associated with obesity, like heart disease, diabetes, and high blood pressure. It works by controlling your appetite, and it's important to follow your doctor's instructions for the best results. Before starting tirzepatide, always read the medication guide and instructions for use provided by your pharmacist. Make sure to check the product visually for particles or discoloration before using. Remember to clean the injection site with rubbing alcohol before injecting each dose, and change the injection site each time to reduce the risk of injury under the skin. Your doctor will direct you to inject this medication under the skin in the thigh, abdomen, or upper arm, usually once every 7 days. To minimize side effects, your doctor may start you on a low dose and gradually increase it. This medication can be taken with or without meals. It's important to use this medication regularly to get the most benefit from it, so remember to take it every 7 days and mark your calendar with a reminder. If needed, the day of weekly use may be changed as long as the time between doses is at least 3 days, 72 hours. Be sure to follow your doctor's medication treatment plan, meal plan, and exercise program. Lastly, make sure to learn how to store and discard medical supplies safely. Some common side effects at the injection site, such as swelling, redness, or itching, may occur. Nausea and tiredness may also be experienced, but these symptoms typically improve with continued use. Contact your doctor if any of these side effects persist or worsen. Remember that this medication has been prescribed to you because the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it's important to be aware of potential symptoms of dehydration, kidney problems, vision changes, mental/mood changes, or low blood sugar. Seek immediate medical attention if you experience any signs of pancreas or gallbladder disease, or if you notice symptoms of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to consult your doctor if you experience any other effects not listed here. If you have concerns about side effects, contact your doctor or pharmacist for more information. This medication may cause a specific type of thyroid tumor in rats, but it is not known if it can cause similar tumors in humans. You should talk to your doctor about the benefits and risks of using this medication. Do not use this medication if you have a personal or family history of a certain type of cancer, medullary thyroid carcinoma, or a certain inherited disease, multiple endocrine neoplasia syndrome type 2 or MEN2. If you notice any signs of thyroid tumors while using this medication, such as an unusual growth or lump in the neck, difficulty swallowing, shortness of breath, or unusual and lasting hoarseness, you should tell your doctor right away. Before using Zepbound 2.5 mg per 0.5 ml subcutaneous pen injector diet aids, make sure to talk to your doctor or pharmacist if you have any allergies or if you have a medical history of certain eye problems, pancreatitis, gallbladder disease, kidney problems, mental/mood disorders, or stomach/intestinal disorders. If you have diabetes, this product may affect your blood sugar, so it's important to monitor your blood sugar regularly and share the results with your doctor. Let your doctor know if you experience symptoms of low blood sugar. They may need to adjust your diabetes medication, exercise program, or diet. This medication may make you feel dizzy. Avoid alcohol or marijuana, as they can increase this effect. Do not drive or operate machinery until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that this medication should not be used during pregnancy, as it may harm an unborn baby. If you become pregnant or think you may be pregnant, inform your doctor immediately. Additionally, it's unclear whether this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Zepbound 2.5 mg per 0.5 ml subcutaneous pen injector diet aids. This medication should not be used with any other product containing tirzepatide or similar medications like dulaglutide, liraglutide, and semaglutide. Additionally, it's important to note that this medication may decrease the effectiveness of hormonal birth control pills, especially when first starting treatment or when the dose is increased. This could potentially lead to an increased risk of pregnancy. It's recommended to discuss with your doctor or pharmacist about using reliable backup birth control methods for 4 weeks after starting this medication and for 4 weeks after each increase in dose of tirzepatide. Any new spotting or breakthrough bleeding should also be reported to your doctor, as these may be signs that the birth control pills are not working effectively. If you or someone else has taken too much Zepbound and is experiencing severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, reach out to your provincial poison control center. Remember not to share this medication with anyone else. It's important to have regular lab and medical tests, such as kidney function, blood glucose, and weight, while you are using Zepbound 2.5 mg per 0.5 ml subcutaneous pen injector diet aids. Make sure to keep all of your medical and lab appointments, and consult your doctor for more details. If you happen to forget a dose, you can take it as soon as you remember within 4 days, 96 hours, after the missed dose. However, if it has been more than 4 days, 96 hours, then you should skip the missed dose and continue with your next dose at the regular time. It is important not to take a double dose to make up for the missed one. When storing Zepbound 2.5 mg per 0.5 ml subcutaneous pen injector diet aids, it's important to keep it in the original container in the refrigerator to protect it from light. Make sure not to freeze it. If needed, you can store it at room temperature, but it must be used or discarded within 21 days. Once it has been stored at room temperature, do not put it back in the refrigerator. Remember to keep all medications away from children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard it when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.